Virtual endoscopy in urology. Modern medicine seeks to minimize surgical trauma, which means there's a need for complete preoperative patients screening and examination. Minimally invasive medical technologies, laparoscopic and endoscopic interventions require a thorough knowledge of the individual's anatomy, vascular architectonics, nature of the pathological process, and other details pertaining to the surgery area. Surgeon should know everything there is to know before the operation. Choosing the correct surgical approach and forecasting possible problems and complications takes a dataset gathered from various sources. Virtual endoscopy is a relatively new, promising examination method. It combines the best computer modeling and high-speed X-ray or magnetic resonance scanning have to offer. By the middle of the 90s, the principles of 3D visualization of internal organs using data from CT, MRI or ultrasonography were established. Virtual endoscopy means visual assessment or evaluation of the potentially existing internal structures of an object. In 1990, the first international symposium on computer modeling in medical endoscopy was held in Sydney, Australia. 2002 to 2006, researchers at the Urological Clinic of MGMU, the Sechenov University, conducted a study aimed at determining the reliability of virtual endoscopy as a diagnostics method. The study included 164 patients suffering from various diseases. The diagnosis received with the help of virtual endoscopy was confirmed in 137 of them. Modern endoscopic surgical procedures in oncourology, as well as development of retrograde intrarenal surgery, make extensive use of data acquired through virtual cystoscopy and ureterorhinoscopy. Thus, virtual endoscopy can be the basis of computer simulation of the upcoming surgical procedure. Doctors will be able to examine the individual's anatomy model that practically corresponds to the real endoscopic picture, see everything that will have to be dealt with during the upcoming surgery, like features of the urinary tract, location of tumor or stone, details of their localization. We use DICOM Viewer software developed by Inobitech company from Voronezh, Russia. Here are a few clinical cases to help you see the capabilities of virtual endoscopy. Above is the picture obtained with the help of virtual endoscopy. Below is the one taken with the traditional endoscope. First case, a 55-year-old patient with a cystic and solid formation in left kidney, according to MRI. We conducted virtual endoscopy and took a sample during ureterorhinoscopy. The diagnosis was a malignant tumor of pelvis of the left kidney. Treatment plan executed implied laparoscopic ureteronephrectomy and laser resection of the orifice. You can see the state of the kidney removed in the video. Second case, a 63-year-old patient feeling sick for 2 months. CT scans revealed a 25 mm formation at 7 hours in the urinary bladder. Virtual cystoscopy allowed visualization of the tumor above the right orifice. Unblocked tumor resection was performed. Third case is a stricture of the piero-ureteral segment. You can see the ureteroscopy data on the screen. The last case implies virtual endoscopy with urolithiasis. Problems. Urinary tract in the area of interest needs contrast. It is difficult to position and control camera manually. Prospects. Ureterorhinoscopy modeling. Surface modeling as part of the software developed jointly with the software company. Conclusions. We see promise in using virtual endoscopy in the context of endoscopic surgery of the lower and upper urinary tract.